What's up, you idiot? Today, the discussion topic is Caesar. 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 Caesars are hypersynchronous excitatory activity of the neurons located within the cortex. Very, very important. This is a hypersynchronous activity of the neurons located within the cortex. In patients with seizures, prolonged excitatory cytotoxicity and focal hypoxia, prolonged excitatory cytotoxicity and focal hypoxia due to increased demand can cause cell death, preferentially in the cortical structure where seizures are generated. Seizures are generated in the cortical structure and it can cause cell death. This creates an areas of cortical laminar necrosis. Now we will look for this MRI. In this MRI, there is hyper intensity in the cortical lamina, in the gray matter, hyper intensity in the cortical lamina, in the gray matter, which reflects the cell death due to excessive metabolic demand. So, if you get a patient with seizure, why we are giving MRI? And in MRI T1 film, in MRI T1 film, you get cortical laminar necrosis. And to look for the cortical laminar necrosis, we actually give MRI. So seizures requires aggressive treatment to prevent the secondary brain injury. We know that in seizure, there are multiple treatments given, trying to prevent, trying to stop. So, two things. If there is seizure happening, then we will try to stop and we will give further medication for prevention for happening again the next for happening the next seizure. So what is seizure? Seizures are the hypersynchronous excitatory activity of the neurons located within the cortex. Hypersynchronous excitatory activity of the neurons located within the cortex. And in patients with seizures, there is prolonged excitatory cytotoxicity and focal hypoxia due to increased demand and can cause cell death, preferentially in the cortical structure where seizures are generated. So, hypersynchronous excitatory activity within the cortex and preferentially involves the cortical structure and causing cortical laminar necrosis. Hope you enjoyed.